Good afternoon. Can everyone hear me okay?
I can. You cut out just a little bit. I can hear you though.
Okay. Well, good afternoon, everyone. We're so glad you were able to join Adam and I this afternoon to talk about updates for enrollment assisters related to COVID-19 impacts on programs, policies, and income counting. And we know everyone is very busy, so we appreciate your time. We will have ample time at the end of the presentation for questions, but you are also welcome to put questions in the chat throughout the presentation, and we will address them sort of as is opportune. We certainly don't want anyone sitting on a question, a burning question, so we'll address them as they come up. But I'm Shannon Drake. I'm from the Wisconsin Primary Healthcare Association. My role there is patient engagement coordinator, and as part of that work, I do work with the certified application counselors at our 17 member health centers. And my co-presenter today is Adam Van Spankeren from Covering Wisconsin, and I'll let him do a little bit more of an introduction to himself and his work.
Sure. I'm the Navigator Program Manager, which means I think a lot of the people attending probably seen me or know me, but I coordinate our Covering Wisconsin's Navigator activities, which is our enrollment. So if you're familiar with navigators and CACs, certified application counselors, you know that I help coordinate and make sure that we have a strong presence throughout the state, make sure that everybody has accurate and timely information, and can really help consumers access healthcare coverage, whether it's through Medicaid BadgerCare or through the marketplace.
Thanks, Adam. Yep. So today we're convening to talk and share updates for enrollment assisters on COVID-19 related program and policy changes. Adam, if you want to advance the slide, that'd be great. We just want to say welcome and we're glad you're here. It's spring and that makes me happy, and I'm hoping it's making the rest of you happy too. Go ahead, Adam.
Yep.
So just a quick setup and sort of operating procedures here. Everyone is muted. All the attendees are muted. Please use the chat box to answer your questions. I'm hoping that my sound is getting better. If it's not, someone please let me know.
Seems good right now.
Okay, great. If you're experiencing any issues watching the training online, you can listen by phone, and the number appears there in the access code. Remember to only use one option for your audio. Select either your phone or your computer, not both. That just frees up additional bandwidth for additional people to join and makes the presentation go a little bit more smoothly. And then when we get to the live question section, it will also reduce audio feedback issues. Go ahead and advance, Adam. And just to let you all know, these slides will be available after the presentation. A recording of this presentation or one like it will be made available in the very near future. Any handouts you see today will be available after the presentation. And again, a reminder to submit your questions via the chat box. And we'll pause to answer them throughout the webinar, and then we'll have time for more discussion starting at 2 o'clock, if not before. So our agenda for today is to learn about COVID-19 related eligibility policy changes to BadgerCare, EBD Medicaid, MAPP, and food share. To learn how to count COVID-19 response program income for health insurance programs. To learn about COVID-19 assistance programs and policies to help consumers generally, and to get answers to your questions. So I'm going to hand it off to Adam.
Great, thanks, Shannon. And yes, please do throughout the presentation use the chat box for your questions. The way I present, I enjoy interruptions. I think that they generate good discussion, and that the questions people have are often very timely around what we're talking about right that second. We will do our best to differentiate between something that can wait, will generate discussion at 2 o'clock, and we can have a much broader conversation about any particular issues, versus one that might need to be answered right now, which I think, like for the case example, for example, we'll go over a couple case examples later. It might behoove us to open it up right then and there. So we are going to do our best to manage and moderate that. And we'll just kick it off with program policy updates for our state's public benefits program. So BadgerCare, EBD Medicaid, MAPP, Food Share, a couple others. These are things mostly that have been published by DHS. You may or may not have been participating in DHS stakeholder calls, which are really valuable sources of information. And just generally speaking, there have been a lot of changes related to COVID-19 or caused by COVID-19, both at an administrative level or done by waiver to the federal government. This is what I'd just like to give kind of an overarching discussion on the public health emergency. You may or may not have noticed, as you've been trapped inside, that we do still have this going on. There was something in Wisconsin Health News and a couple other sources stating that the emergency declaration ended as of May 12th. That's because that was 60 days unless extended by the state government, or the state legislature, I should say. And that, what that means for our programs, that's the questions I had personally, and I know a lot of others have had. It doesn't change a lot or any of the policy and program updates that we'll be talking about today. Most of those are tied to the federal public health emergency guidance, as opposed to the state safer at home order. I believe the Supreme Court last night as well addressed the safer at home order and its extension to May 26th and shot that down. But in terms of all of the updates to the programs we work with, to the programs we help connect consumers to, there will be no immediate change, because we're going to be talking about things like suspending premiums and things like that. And we don't expect those to be any different right now. We don't have an end date for a lot of what we'll be discussing. So let's go to our first set of programs. So BadgerCare Plus, our state's main Medicaid program, combining Medicaid and the Children's Health Insurance Program, CHIP, has had a number of different rolling changes that, again, DHS has been publishing during and discussing during the stakeholder calls and other calls with partners. Till the end of the national public health emergency, again, we don't have an end date for that. We will want to stay on top of that, and we are staying on top of that, just so nobody gets caught off guard. No consumers get caught off guard when the program suddenly changes, when these expectations suddenly change. But right now, people are not being charged premiums. Current members are not losing eligibility, and that means renewals and terminations have been suspended. I know they are doing administrative renewals when they can, which something like 18% of people are able to. The IM agencies, the income maintenance agencies that process BadgerCare applications, will take a look at different data sources that they have access to, usually income provided by employers, and will be able to say, okay, we can see that your income hasn't changed. We're just going to automatically renew you, and that's an administrative renewal. So those are going on to the extent that they can. Likewise, that rolls into verifications where they're using the best available information. Their IM agencies are able right now to take into account things like, hey, my HR department is not functioning right now, or significant numbers of our staff have been laid off and I can't get the answer I need. So they're going to use the best available information, and again, rely on that data matching whenever possible to verify somebody's income or other information that they reported on their application. Finally, I just want to say the application processing times are allowed to be longer than 30 days. Just normally, the federal guidance to state processing Medicaid applications is you have to process in 30 days. Our state is generally really good about that and beats that by a lot. The current public health crisis has this language to account for the possibility that people aren't able, staff isn't what it should be, what it could be. Processing times may take longer as a result of all of the different policies and programs being altered. I will say in practice, in reality, IM workers aren't taking vacations right now. As far as I know, most of the consortium, if not all of them, are fully staffed and trained up at the moment. So we're not seeing them take longer to process applications, but they do have that option if they need it. Other important reminders: co-payments, cost sharing that is for children was suspended back to January 1st, and that goes through June 30th right now. They may extend that again if they can. They may want to, depending on the state of the public health crisis and pandemic. And just a reminder, a lot of people have had questions on COVID-19 testing and treatment. Under BadgerCare, both testing and treatment are covered by BadgerCare Plus. Also, the drug treatment needs questions. There was the waiver around to childless adults and childless adults on BadgerCare. There were a lot of, we'll say, unpopular changes, I think I can say that, to the program, including drug treatment needs questions and a few other things, along with premiums, which we had discussed, have been suspended. That question has also been suspended. So hopefully that means that any chilling effect that we saw as a result of, hey, we're going to ask this potentially uncomfortable question for you, will also be reduced during this time. We want to eliminate and reduce barriers as much as possible to people accessing these programs or feeling like they can access these programs. For elderly, blind, disabled, or EBD Medicaid, again, through the public health emergency, hospital-based presumptive eligibility is allowed. So what that means, presumptive eligibility and express enrollment are the same thing, but neither is really a self-explanatory term. Hospitals and other providers have the ability to do a shortened version of the application. So on the Access website, there's a section, Access for Partners and Providers, where a provider can sit down with somebody and use self-attested information. So got a person there, checked into the hospital, and you ask them, okay, what is your income? What do you expect your income to be? And normally they can get on BadgerCare Plus. They can now use that for EBD Medicaid for these populations, adults age 65 or older with income up to 100%, and then those who are blind and disabled who are also enrolled in Medicare, usually as a result of that disability, up to 100%. And then the website itself, I had asked DHS about the functionality around this. The application remains unchanged. So right now they are using the current version of Access for Partners and Providers. So again, not the application your average consumer will use, but if you scroll down on that, there's an option to get to this other one where you can log in as a provider. They're able to get in there and use the existing application with the self-attested information. So nothing has changed there. I have no concrete information about how well that's working, how well it's screening, but it does get them into the system. And then the onus is on the provider to follow up and complete the full application. So this is something that's been done for BadgerCare previously. So the new aspect here is for EBD Medicaid. But basically, you can get somebody determined eligible, get them benefits, get those services the hospital paid for, and then later, usually within a month is what the expectation is, the hospital staff will help that consumer complete the full application. So being able to do this for EBD Medicaid is great, just again, because people are going to the hospital, especially right now, that they are often in crisis. They have a serious situation that may very well result in a disability determination down the road, or they may already have one and it may just not be accessing the benefits they could be eligible for. And I'll just make a note here. There was also an expansion of presumptive eligibility for higher income children, but they did have to roll that back as a result of some federal guidance, I believe. The Medicaid Purchase Plan, or MAPP as people know it, is another program that kind of falls under the EBD umbrella. So generally accessed by people who have a disability, but can also do some level of work. Usually that's not a lot of work. Again, until the end of the national public health emergency, all the work requirements for that have been put on hold, and there are also no premiums. Members, I believe they already have, but if they haven't, they will receive premiums, refunds for the premiums for April, if they've already paid them. But that means MAPP right now is, you're working with somebody who has a disability determination. MAPP is a really good option. Again, we want to pay attention to the rolling changes and effects of these programs and policy updates. But right now, if somebody can get in and they don't have to meet the work requirement because obvious reasons, and they don't have a premium, then we should always be considering MAPP as an option to say, okay, you weren't planning on working, but right now we can get you in MAPP. It's great coverage. Use it. Food share, I'm going to talk about some high-level stuff. The PEBT, which I'll get into in just a second, I'm going to leave mostly to Shannon because I know she has much more involved slide on it, which will hopefully shed more light on it because I think it is a little bit confusing. But members have been receiving the maximum amount of food share benefits each month, which is fantastic. It's incredibly helpful in this time because we've looked at things like people's priorities. As assisters, we're expecting to see a lot of people losing health insurance coverage. And what we've seen has been that people have certain hierarchy of priorities where they're looking at their housing, can I pay my rent? Can I pay my mortgage? They're looking at utilities. I don't want my lights to be shut off. I need the internet to stay tuned to what's going on in the world. And then food is very high on that list. So there's been a lot of pretty big spike in food share applications, and healthcare is just a little bit further down. So it's interesting that we have this hierarchy, and then the state sees that and has been responding by giving people the maximum food share benefit. The interviews for food share can be suspended, and I think in a lot of cases they have been. So when you apply for food share, there is this interview process to get fully enrolled. They ask you about some of your answers on the application, things like that. It's pretty straightforward. The agencies, IM agencies, can suspend the interview or waive it essentially. I don't really have a good perspective on whether or not they are choosing to do that, because again, I think capacity is pretty much where it should be at the IM level right now. But they do have that option, kind of like the option that I talked about earlier to extend the amount of time it takes to process an application. So the pandemic electronic benefits transfer. So nobody would ever in their right mind call it that generally. People call it PEBT. Again, EBT is it's a terrible acronym because even the actual words don't mean anything. This is food share essentially, but the PEBT is actually kind of a separate bucket, which again, I think Shannon will get into a little bit more detail on. But so these are being extra benefits, extra food share benefits, and actually an extra card that is getting in the hands of families who are known to the state. So known to the state is generally seen as using another public benefit program. It means they're in access. It means they're in CARES, which is the kind of behind the scenes application processing that the state uses. So if they're able to get free and reduced meals through school, then they are able to get these additional benefits. And I know March and April benefits were paid on May 10th, and May and June benefits, I believe, is slated for around May 24th. That's what they said on the stakeholder call yesterday. But so this is not the same as food share, but it is a food benefit. Some other programs, I wanted to include these. You can find more information on all of these. Certainly, DHS has a really nice COVID-19 section, like a whole platform on their site right now, covering a lot of these updates and these program changes. So I don't want to not include these because there's a lot of different programs that we may touch on and that other assisters may be especially interested in, especially if, say, you're a children, youth, and special healthcare needs specialist. You're going to see these programs, waiver programs, things like that. Those programs normally have a lot of in-person contacts, such as home visits, have been temporarily stopped. I don't have the end date on when those will be opened up again, and I know this is an opportunity where people are accessing telehealth, telemedicine, and just a reminder generally to continue to do that to whatever degree you're able to continue to manage, especially if it's a chronic condition. Take advantage of telehealth, telemedicine. We haven't, hospital systems providers have shifted dramatically to be able to accommodate this need. We haven't overburdened our system, not that we want to open it up, but we just want to remind people to continue to get the help and care that they need, not to put anything on hold, because putting things on hold can result in greater, harm or complicated conditions down the road. So that is the short list of this. That was from the DHS site, was the Birth to 3 program, the Children's Community Options Program, Children's Long-Term Support Waiver, and Katie Beckett. Shannon, have there been any questions come in that have been on the policy program updates yet?
We did get one question, and I will read it for you. It's, what if a person on food share is at high risk and should not go out? Can another member of his or her family go out and purchase groceries with the food share card with their permission?
That is a slightly political one. I won't venture to answer. I would say that's one I would pose directly to DHS to see if that's allowed. There are a lot of rules and laws, guidance around, hey, don't give your card to another person. So that is the general guidance for that. I would want to clarify anything I would say on that with DHS. I certainly think that is something that is happening. Whether or not it should or is allowed is kind of more of a gray area that probably is ultimately a black and white area that I can't get into right now.
So So we will pose that question to DHS, and if we get a response, we'll make it available.
Yeah, and I certainly think, that it seems like a common sense, workaround for people. Especially, I think there are cases where if somebody has a caregiver or something like that, where they can have that relationship in place. But if it's informal, I think we'll want to get the answer directly from DHS, and we can follow up with them.
Yeah, we do have another question, and it's you stated that PEBT is an extra card, meaning those benefits are not placed on the consumer's existing Quest card, correct? These cards will automatically be mailed to those known to state programs. And Adam, I can take that one.
By all means.
Unless you want it.
No, let's go ahead.
So PEBT is an extra benefit. It's tied to the student's eligibility for school-based food nutrition programs. However, the way these benefits were issued, that it's if the families were known to DHS's system, the benefits were actually added to the existing Quest cards. And they may have been added, if there are multiple children in the household, they may have been added all at once, or they may have been added on separate dates, just kind of depending on how people exist in the system. DHS went through a data matching process with the Department of Public Instruction in order to issue those benefits. And then for families who don't have a food share card, they were mailed, but known to the DHS system, they were mailed a specific PEBT card. It's a white card, and mailed to them with a letter and instructions on how to use it. And so those families receive that. And then to families who aren't known to the DHS system, so they're not receiving another benefit from DHS, like they're not on BadgerCare, they're not receiving food share, they're not receiving child care assistance, so they're just not part of the system. Those families are getting directions on how to apply for PEBT through their school districts. Right. So they should be getting letters and information, emails from their school districts with links on how to apply for those benefits. And if there are families who have children on school nutrition programs and they haven't heard from their school districts and they haven't received these benefits automatically, then after May 20th, we recommend that they reach out to their school district and request information and help applying for the benefit. So, if they're unsuccessful or haven't automatically gotten something by May 20th, then they should be proactively following up. And we'll talk about that just a little bit closer.
Yeah.
Or a little bit later. My apologies.
No worries. There's been a lot of discussion on how to reach those families who aren't known to the system. In a lot of cases, somebody is, for various reasons. Again, any one of these connections, any one of these programs can help somebody be identified to DHS. But there's been a lot, and hopefully the school district model works pretty well in getting people these extra benefits that they may need, especially right now. So the very short answer to your question is both. There's a little bit of both going on, where if they have the card, they have food share already, that it'll be added. But if they haven't been known to the system, or if they are known to the system but not getting food share right now, they're being mailed the card with additional instructions. The only other thing I would say around food share that is just kind of a back of your mind update that is pretty cool that we heard on the stakeholder call yesterday is just that they are working on allowing people to use EBT Quest cards, food share cards, to purchase things online, to purchase foods online for participating vendors. That, I believe, it is in its very initial stages, and they're getting approval. The state, being they, is getting approval from FNS, the Food Nutrition Service at the federal level, to be able to roll that out. So that is an exciting thing that's on the horizon. And I think that the pandemic, stimulated how quickly they can move on it, but I'm guessing it was something that has been on their plate for a while, considering how much it's been requested in the past. Cool. And it looks like Jenny sent a link with the COVID-19 policy updates, DHS. I'm glued to that page. I have it bookmarked. I highly recommend other people to be as well, just because, well, sign up for the community health community partner updates through DHS, and you'll get alerts on important changes. Forward health updates are also valuable, but they can be confusing because in addition to seeing something like, hey, we've expanded the eligibility for this group, you may also get something like, hey, hospitals, we have this new code for you, please use it on the back end. So just take that with a grain of salt. Community partner updates are broadly valuable and targeted to us as assisters and community organizations specifically.
I'm not
I
seeing
guess
additional questions, but I want to give everybody just a moment to type any in. And Jenny, you let us know if you see them. Maybe, Jenny, if you could just send a message whether you have more coming in or not.
Sure. I don't have any more at this time. Thanks.
I think that's probably right. I think though the policy updates, generally speaking, are pretty straightforward. They're designed to make the programs easier to access, more generous, and to make sure people aren't falling off. The general reminder that I think people are probably sick of hearing me say is to really stay tuned for finding out about additional communications from DHS, especially when the end of the public health emergency is on the horizon, because we don't want anybody who has absorb some of this information to say, I'm good, my renewal happened, or it was delayed, or I'm not getting kicked off the program for any reason right now, I'm good. We don't want them to end up in a transition from the month that they are good to the next month that they may no longer be eligible under these policy program updates and end up in a situation where they would have to repay any medical expenses or things like that. So we're really paying attention to the communications around these updates to consumers as well.
Okay, we did get another question, and that's about emergency Medicaid. Are there any changes to emergency services, either eligibility or scope of benefits? For example, clarifying that COVID testing and treatment are covered services.
Oh, that's a great question. I haven't heard of any changes to emergency Medicaid. It's a fairly, we use it when we need to, obviously, and it's awesome for assisters to know about. So if you don't, this question is referring to the program, somebody especially who is ineligible for other programs, not childless adults, so typically children and people who might qualify for BadgerCare, but can't, usually because of immigration status. That's when we use it most of the time. Can get a service or a set of services related to a health emergency covered by Medicaid. So that's what emergency Medicaid is in a nutshell. I haven't heard of an expansion of services. I would probably, we can follow up on that, and we will, and we can get you guys a solid answer. I'm guessing that if it falls under the Medicaid umbrella, if the federal law and guidance says one thing, that's typically what will be the default answer. So I would assume, because the answer we got on Medicaid and BadgerCare is testing and treatment covered for COVID-19, that would also qualify for emergency services Medicaid. And that, given the current pandemic public health crisis, it's something actually that should be in everybody's mind, because that might be the situation that presents itself. And it would certainly, to my mind, qualify as an emergency. So it should be fairly easy to get the notation you would need from a provider to get those services covered. Will there be any changes to miles opening anytime soon? I would want to follow up with DHS on that, just because they have Maciel and others who work in Milwaukee. She, I know, has a really great relationship with Miles. Our own navigator lead in Milwaukee may have heard something as well. I have not heard of it opening anytime soon. They have a certain amount of discretion to do that. So I actually haven't heard about any, so that would be any, Miles is the Milwaukee Enrollment Services Center, so the IAM consortium for Milwaukee County. I would expect they would follow suit with what other IAM agencies have been instructed to do, and I haven't heard about them changing and opening anytime soon. If somebody else has heard something, certainly valuable information. And then, let's see. To my knowledge, it hasn't been changed, but wanted to make sure people knew about it short. Yeah, so I think that's related to emergency services Medicaid again. Yes, thank you for bringing that up. I think it's an awesome reminder and one that I hadn't thought of. So I really appreciate that that came up at all. Okay, thanks, Maciel. No update yet on Miles hours. It's great to know you're on. Appreciate it.
Okay, so
yep, go ahead,
I
Shannon.
think
Yep.
we're going to go ahead and move on. And again, at 2 o'clock, once we finish the presentation, we'll have a more open discussion and have time for additional questions. So if you think of policy change questions that you have, just hang on to them and we will return to questions a little bit later. So right now, we're going to move on to talking about financial eligibility considerations during COVID-19. So we're going to focus this conversation on new assistance programs or policies that have come out and their impact on financial eligibility criteria for various public benefit programs as well as the marketplace. So there's a lot of some confusion because there is one important difference in how some of these income from these programs are counted. So we're just going to review the information first. So I'm going to go from the bottom up on this slide, actually. So the COVID-19 stimulus check. So the money that came from the IRS to many households and families, the $1,200 or $2,400 plus $500 per dependent child, that is not counted as income for any of the programs listed here. So it's not income for Marketplace, it's not income for BadgerCare, it's not income for food share, and it's not income for supplemental Social Security income. It is just not counted. And additionally, when you're thinking about, so what happens to it in terms of asset determinations, they just set that money aside for 12 months. So next, we're going to talk about 3 parts of unemployment insurance, 3 new unemployment insurance programs that were rolled out as part of COVID-19 response by the federal government, but they are administered by state governments. So in Wisconsin, that's DWD. So pandemic unemployment assistance, which temporarily expands unemployment insurance to more people, so to self-employed people, to those gig economy workers. You've likely heard about this in the news or experienced it firsthand yourself or with the people that you assist. Money received through that program is counted as income for all these programs. Likewise, money received through the Pandemic Emergency Unemployment Compensation Program, which would be the extra 13 weeks, in addition to the 26 weeks. Is that right, Adam? 26 weeks?
Yeah, that's good.
Okay, 26 weeks
Yep.
of regular unemployment insurance. So people actually wouldn't yet have started receiving this money, but when we come up against the end of 26 weeks, well, that's not true. Some people might have started receiving this money back, depending on when their initial unemployment claim started. That is counted as income. So just regular income consideration for all programs. The last unemployment insurance program tied to COVID-19, the Federal Pandemic Unemployment Compensation Program, which sometimes is just referred to as the Pandemic Unemployment Compensation, but Wisconsin's DWD refers to it as the Federal Pandemic Unemployment Compensation. That is the extra $600 a week that people on unemployment are receiving. For the purposes of Marketplace, it is counted as income. For the purposes of BadgerCare and Medicaid programs, it is not counted as income. For the purposes of food share, it is counted as income. And for the purposes of SSI, it is counted as income. So this is where things get a little bit complicated. So, to talk a little bit more about this federal pandemic unemployment compensation, because it's the tricky one. Again, this is the extra $600 per week paid in addition to regular unemployment insurance. People don't apply for this separately. It just comes with their regular unemployment insurance payment. And these
Yeah, Shannon, just want to, anything you can do to speak up or get the mic closer, people will be overjoyed, I would say.
I am so sorry.
It's okay.
So this is the extra $600 per week paid in addition to regular unemployment insurance. You don't apply for this separately. It just comes with your regular unemployment insurance payment. And these two payments arrive as one lump sum. So if you're looking at a bank account statement, this is just going to look like one payment. So it's going to be unemployment insurance plus federal pandemic unemployment compensation in one sum. So if someone was to receive $970 weekly in unemployment, what that would actually be would be $370 of unemployment insurance plus $600 of the federal pandemic unemployment compensation. So I think it's important to note here that $370 is the maximum weekly unemployment benefit in Wisconsin. So, that should just tuck that in the back of your mind. And, unemployment payments right now are going to look higher than you're used to seeing. And just remember that that's because of this $600 federal pandemic unemployment compensation. And this program is set to run through July 25th of 2020.
And I just want to throw a note out there for assisters. When somebody comes to you and they're showing you their unemployment documentation, just bear in mind that they can, and a lot of people do elect to have taxes taken out. So the amount may be different, but you should be still using the whole taxable amount of the income. But if it's 970, you might see it pay 818 or something like that, for example.
Thanks, Adam.
So am I up for the case example?
You're up for the case example.
Okay. Let me move these different boxes on my screen so I can actually read it, and then we'll be good. So we wanted to include a couple examples to get people's brains kind of thinking about this. This situation with the pandemic unemployment assistance or compensation has been, it's created what I have been referring to, but has not been coined as a new gap, because we're used to seeing gap cases. This creates a new difference in the way the income is counted between the marketplace and BadgerCare, which means you could have dramatically different outcomes. Given the amount of this extra assistance that is counted for one and not counted for the other, the difference is pretty significant here. So for this case example, we have Sam, single man, is receiving unemployment check for $800 per week. So he's getting $200 in unemployment insurance or unemployment compensation, and $600. So he's not getting the maximum $370, but he is getting the $200, which would normally qualify him for BadgerCare. So discounting the $600, he is eligible for BadgerCare. So he would want to look at BadgerCare first. He's going to see, when you look at that documentation he brings you, you're going to see, he's getting $800 or $800 less taxes, but the actual unemployment amount that's looked at for BadgerCare is the original $200, whereas the $600 would be discounted. So you want to look at BadgerCare first, because if he turned around and applied for the marketplace, his income would be over $30,000, be $31,000 if you just looked at 39 weeks essentially of unemployment at that amount. And we are using, there's only, so if somebody came to you today, there's only like 34 weeks, let's say, left in the year, I think. But we're using 39 for these examples. So bear in mind, there may be other factors. There are examples that are simple as we can get them. But basically, the dramatic difference between $800 a month for BadgerCare and over $30,000, including any income he might have had earlier for the marketplace, is significant. So we definitely want people looking at BadgerCare first, because you could be looking at BadgerCare eligibility with essentially 100% coverage for all the services he needs versus marketplace coverage with very, very high premiums and possibly no cost sharing reduction. So well over 250% of the poverty level. And I just want to see, I had to close chat, but are there questions on that? Because we do have a more complicated one coming up. again, just the takeaway for people is to when you're looking at the amount, remember to discount that additional benefit, the additional $600 for BadgerCare, and to look at BadgerCare first. I don't think I can say that enough. So we have a more complicated one. We have a family now where unemployment is a factor. So Clara Jones is a mom in a family of 4, and she wants to get coverage for her whole family. She is getting the maximum unemployment amount of $370 plus the $600 per week. And she has a husband, John, who is getting about $200 a week in wages. They have 2 children, ages 4 and 10. And I guess my question for everybody, I don't know if people are going to bust out their calculators or their FPL calculators. How would you count this income, and what programs would you apply for? I will give people a second to think about it and weigh in with any considerations, or if any particularly sharp viewers and expert enrollment assisters want to just come up with the answer, we welcome that. Otherwise, I do have the option to let you off the hook on the next slide. Are we getting any takers, Shannon? Oh, you're muted still.
I don't see any responses. I think they have to come through Jenny first, though.
Oh, is that how it works?
Oh, here comes one. All right.
Okay, cool.
Over income, so the response is over income for BadgerCare would qualify for Marketplace. Do we have any other responses? Somebody has said Marketplace for adults, Medicaid for kids.
Cool. That is essentially the right answer. And we'll look at why. We'll break that down now. But so good job, Kathleen and Susan. All right, so let me close this chat so I can actually see the answer again. So how this turns out to be calculated, if you're looking at Marketplace, you're looking at annual income. Just everybody who's an assister is used to hearing, annual for Marketplace, monthly for BadgerCare. If you look at the annual income, and again, calculating on 39 weeks of unemployment, so bearing in mind an actual person's situation might be a little bit more complicated, you're seeing at least $48,000 in income for the family, because you've got husband John's income and you've got that unemployment, in this case, brought out to the maximum amount, and then anything that she was making before she was laid off or lost her job. So the income for the Marketplace is going to be significantly higher than it would be looking at BadgerCare. And in that case, minus not counting any income we don't know about in this situation, we're seeing at least 184% of the federal poverty level, which means that those parents are going to go to the Marketplace. Whereas at the same time, you're going to want to look at monthly income for BadgerCare, which in this case, I did pretty rough calculation just using 4 weeks. Some months are different than others, obviously, but you're getting about 2,280 or 104% of the poverty level, which is well under for the income level for children to be on BadgerCare. So yes, you'd want to be on BadgerCare for the kids and the Marketplace for adults. And I did hear didn't hear, but I heard from assisters who watched some of the health reform beyond the basic stuff. And I was told through CMS that the application for the health insurance Marketplace on healthcare.gov was updated to take this into account. I did a test application earlier. I think my scenario might have been a little too simple to trigger it, but I'm guessing that means that there is that being taken into account in terms of the transfer, the FFM transfer to the state for BadgerCare. So I don't know how well that's working. I was told that they had done it, but if you were to apply for the Marketplace, you would probably either want to make sure that the children were transferred to BadgerCare. So check with your IAM consortium, make sure that eligibility notice says what you think it should say, or go right to BadgerCare first, get the kids on, and have the adults either do the Marketplace application separately or have the state transfer them over to the Marketplace and follow up. So in a situation like this, there will be follow-up required. I think we're all more or less used to doing that in complex situations like this. But this is what that looks like. And again, the difference is significant. In this case, it's an 80% difference in FPL, counting the extra unemployment income. They would still be under 250 for cost sharing reductions, which would be good. but you're just getting very different insurance and coverage situations based on these new benefits. Did any other questions come through on this?
I have not seen any other questions come through.
Hopefully, we made it make sense, or that's what that means. I'd like to think so. You're going to see more complicated situations than this, even, I will say. And just remember, again, when people show you their information, you're going to want to look always at the full taxable income, because what they show you might be, I received this much. And so, Shannon, did that question come through? Do these apply through till July?
Does this only apply until July? So as far as the policy is right now, that extra $600 per week in the the federal pandemic unemployment compensation is through July 25th. Yeah.
But the way that it's counted would be consistent beyond that, if I'm not mistaken.
Yes, so I think if we saw federal legislation extend the date of those payments, then I would assume they would continue to exclude Medicaid, because that actually was in federal policy that 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 $600 would not be taken into Medicaid financial eligibility considerations.
Right. And it looks like we got a question about crowd out, which was one of my early questions in seeing this. One that I didn't want to say harped on, because it's a very negative connotation, but one that a drum I beat significantly was, if these programs, and it's a really astute question, because if you're eligible for BadgerCare, the marketplace wants you in that bucket. And if you're eligible for marketplace because of your income, the BadgerCare Medicaid, the state wants you in that bucket, which is why I've been describing this as the new gap case. The guidance and the answer I got when I was banging the drum of this question was that that this situation as it is here would work. You're applying for BadgerCare first, and if they're BadgerCare eligible, you'd want them to be on BadgerCare using the rule that allows them to be on BadgerCare. So I don't know if there's official language around how this crowd out being changed or suspended, but the guidance we've been given is to get them on BadgerCare. Even though if you look at their income the other way, looking at the marketplace. Again, I'm staring at the example, so I'm thinking about that. But if you use the example, you're using both. But generally speaking, you'd want to go to BadgerCare first, and not, if they were BadgerCare eligible, you'd get them on BadgerCare, and you wouldn't worry about the way the income is counted for the marketplace.
And we do have another question, and that's, so to clarify, the $600 additional from unemployment is discounted for Medicaid, but not for marketplace. And that is correct.
I would say, yep, that's exactly the takeaway.
So we have another question, and it's, if the pandemic unemployment ends July 25th, are we supposed to include it for 39 weeks? So this is talking about a marketplace application.
Sure. So for that, I would say no. When I was coming up with these examples, I was kind of counting on it being extended. I would say you could count it until then. I tend to want to overestimate just to reduce somebody's possibility of getting a tax penalty for having their premium tax credits be off. So you may end up overestimating, but the takeaway I would say for that is to really just continue to pay attention to policy updates and changes in the law that come down, because the dates and the goalposts essentially keep getting pushed around, and we want to make sure that people are as accurate as possible in reporting their income, and that they don't get exposed to any kind of penalty for having income that's reported differently.
We got another question, and that's, would you suggest that they go on BadgerCare after the $600 ends?
Short answer for that is I would suggest that somebody goes on BadgerCare as soon as they're eligible for BadgerCare. Looking at the household situation, obviously everybody's situation is different, but if I'm looking at their situation and they're eligible financially for BadgerCare, I would want to get them on BadgerCare as soon as possible.
Yeah, and so just to reiterate the point here, the $600 doesn't count for BadgerCare. So you
Right.
set that aside offhand. So if you take away that $600 and you're just looking at, say, in this example, the amount that she's getting for straight up unemployment, and if under that scenario, Clara and John are eligible for BadgerCare, then get them in BadgerCare.
Right. Whereas, like with the previous example, regardless of whether the 600 is ended or not, he should be on BadgerCare.
Any other questions? These are great questions.
They are. This is the kind of discussion we were hoping for, I think.
Okay. Oh, one more. What happens when the consumer doesn't want to reveal his or her full income? In other words, they do not want to be truthful because they think it will hurt them.
Now we're in pretty complex territory, I would say. We can only make someone be so truthful. You just really, as an assister, it's your job to explain the consequences of essentially what that's describing as fraud. And I understand concerns around, I think that this will have a negative outcome and I don't know exactly how I should report it. But generally speaking, you want to lay out, okay, you do need to be as honest as you possibly can be on this application. You want it to be accurate so you don't have any financial exposure from it. I certainly wouldn't use those words with a consumer, but you want to make sure that they don't get penalized later on, and you certainly don't want them committing fraud. So you can only get the information that a consumer will give you. So you do the best you can is the short answer. All right.
How long will unemployment recipients receive the $600? Okay, so that benefit, that federal pandemic unemployment compensation benefit, the extra $600 goes through July 25th, 2020.
Right. So, you're seeing situations where if somebody was already on unemployment and they may have been getting it already, they may be into their 13 weeks. They're the extra, the PEUC, I believe, so they were already through half their unemployment when the pandemic started. They may have gotten onto those 13 weeks, and they could get that through July 25th, essentially. So that's what it is right now. And again, this goalpost may change, but that's what it is currently. And just from a point of processing, for the additional 13 weeks on the DWD, the unemployment website, you don't have to do anything differently. We don't typically go into someone's unemployment and help them directly with that, but I certainly have, usually for people I know in this case. And the guidance is to just continue doing the weekly certification for unemployment. And if you're eligible for the additional benefits, you should continue to get them. I think they have an extra level of assessment on the back end, so they may not see them right away. Versus the PUA, which is if you weren't eligible for unemployment, so you've exhausted it, you're self-employed, or you have kind of a gig-based job that doesn't typically allow for unemployment. That is also through the unemployment website, but that is a separate process, just to keep that in mind.
Okay, so we have a few more questions.
Okay.
Something just moved on me. What if a client has Marketplace but has reduced income now because of the COVID pandemic? Should I encourage them to apply for BadgerCare or stay in the Marketplace? They hope to increase income as the state reopens.
Sure. We see similar situations to that even without a pandemic. There's people who there's still a stigma around BadgerCare and public benefits, and I think that if anything, the pandemic has at least helped in the stigma regard, because people now see, okay, I do qualify for this, I should use this benefit, I've paid my taxes, that kind of thing. But that's really a case-by-case basis. If somebody is BadgerCare eligible on a monthly basis, I would want them to get on BadgerCare. But there are considerations to keep in mind in that situation where if somebody had already met their deductible, their out-of-pocket maximum, and they want to keep that insurance, the trick is going to be when you go to report income changes. If when you report an income change through the marketplace, it's asking you about employers specifically, including the employer phone number. So if somebody is optimistically saying, I think I'm going to go back to work, if they still have that employer and expect to go back to that employer, you can probably estimate that and keep their annual income where you want it. If they're receiving unemployment, you may count that and see that their income, just if they want to stay in the marketplace, there are ways to do that. I don't. Every situation is different. You might see somebody who's like, okay, well, during this time, I'd like to say that I'm, doing consulting and I want to increase my income that way. And the short guidance I would give on that is just be realistic. Again, you don't want to venture into territory where you're approaching fraud. But if somebody, has again already met their deductible and out-of-pocket maximum, and maybe they're managing a chronic condition, and that insurance that they have, they like it and it's important to them, there are ways to look at income that may keep them eligible for that the whole time. I would say, actually, we probably shouldn't venture any deeper into that particular question, because the next training, the one next week, covers marketplace specific scenarios, and I think that a lot of these would be better fielded at that one.
I was just gonna say that, Adam. So
Sure.
yeah, we'll be I think we'll have some more scenarios specific to that question next week. So tune in same time next week, and we will delve more into marketplace considerations. We have had a few more questions come through. One was, is there a specific number of weeks that unemployment is available? And yes, in Wisconsin, that's 26 weeks is the standard unemployment benefit. And so then the follow-up question was with that was, so why would we calculate 39 weeks? And I believe this is in regards to marketplace applications.
Yeah, I was using those as an example just for the maximum, and you likely wouldn't see 39 weeks unless, again, that gets extended, which the original language around it was that it would be available through the year, and there's still a lot of unknowns around that. You'd want to use the unemployment weeks that they have left for the year, plus going out to the July date to get the amount accurate. But the maximum that we use for our examples, the total weeks somebody could be on unemployment with the additional 13 weeks would be 39.
And we have another question. It's how many total weeks could it be possible to receive the PUE? When did it begin? So is that in reference to the pandemic emergency unemployment compensation, which is the additional 13 weeks?
Right.
Go back to the table that has all the unemployment.
Yeah, no problem.
Because again, they're new terms, and so sometimes I'm not sure when you're saying PUE which program you're asking about.
They're new terms that sound very similar. So
so if you could look at the choices there, questioner, and then let us know which pandemic unemployment program what you're wondering about, we can respond to your question.
And these began in March, I believe, right? I don't have the date in front of me.
Oh, okay. So referring to the federal pandemic unemployment compensation. Got it. So that the first payable week of that was retroactive to the week of April 4th, and the last payable week is July 25th.
Right. And again, the second one, the 13 weeks come into play if somebody exhausts their unemployment, which again, if they were already on unemployment and maybe approaching the end of it, that's what you'd be seeing now.
Okay, so in the interest of time, these have been great questions. And we have another question that maybe we will take up after we get through the rest of the content of the presentation. So just hang tight on that one. So I just wanted to make sure to share with you all that you're out there, you're assisting people with health insurance, and many of you are well versed and well equipped to help people with other programs, or at least point them in the right direction and get them started. But we just wanted to do a quick rundown on some other programs and policies that we want to make sure people are aware of and that you can help consumers and patients and community members get connected to. So food share, right? Adam talked about people's hierarchy of needs, and right now we know a lot of people need help obtaining food. So just to know, if you didn't already, that the food share application is the same as the BadgerCare application. Right now, most food share applicants won't have an interview. If they need to have an interview, they will do it over the phone. And then generally, food share members may be getting additional food share benefits for March, April, and May, and that's because they went up to the maximum allowable amount for families on food share. So people have seen increases. We want to help people with energy assistance if they need it, and there were some changes in response to COVID-19 made to Wisconsin's energy assistance program, where they're basing eligibility determinations off of last month's income rather than the last 3 months' income. So this was to acknowledge that a lot of people saw drastic reductions in income, and they want to get people signed up for this program if they need help with their new economic reality. We've spent a lot of time talking about unemployment, and I suspect we'll return to it shortly. So we just want to, encourage you all to point people who have lost employment to the Department of Workforce Development to apply for unemployment, to encourage them to keep calling, keep going to the website. We know there are long waits. We know there are issues. We know it's painful. But to encourage people to keep at it, to apply for these for unemployment insurance. This is something that many people have paid into for many years. It is an insurance program to which they've contributed, and they should apply for it if they need it now. And then if there are issues, if people, have submitted their information and aren't hearing back, the most successful mechanism we're aware of for getting the attention is to report those issues to their state representatives. Let's briefly talk about the pandemic EBT, and this is the temporary food benefit for families with children who get free or reduced price meals at their schools. So we have a little picture of what the card looks like. So if families don't already have a food share card, this is this white card that says Wisconsin PEBT and has an apple on it, is what they'll be mailed. If they are already known to the system, they would have already received this. And if they're applying for this through their school district, so they would have gotten notification about PEBT through their school district, and sent a link and instructions on how to apply, or a phone number and on how to apply. When they're successful at applying, it will be this white card. I want to be really clear that although this is a food benefit, this is not food share, and that this program does not have any negative impact on immigration status. It is not considered, it is not a part of a public charge test. And for those of you that assist immigrants and mixed status families, that's an important note. So just know that. And again, some families will need to apply for this benefit if the family isn't known to the DHS system. They'll get information from their school district, and if they haven't gotten information from their school district, help them reach out to their school district to get that information. Especially, if nothing has happened by May 20th, then you really want to start with proactive assistance in getting people this benefit. I just wanted to let people know that for people who have federal student loans, that student loan payments have stopped, and that's between March 13th and September 30th. Federal student loans will have a 0% interest for that same time period. And for people who have non-federal student loans, they could call and ask their lender for administrative forbearance. Now, there's no official policy on what that lender does or doesn't have to do, but there's a lot of student loan lenders who are offering flexibility during this time. And so people should call in, but people do have to call and ask for it.
Yeah, and the other ones I believe just kicked in, right? Is that, no, it says
Yeah.
automatic. That just kind of happened, right?
The other ones were automatic. And the thing to know with this, if somebody isn't in dire straits, if they're still working and if they can still make payments, then they'll be making interest-free payments, which will help them pay down their principal more quickly. In all of this, you might get questions about immigration and public benefits. And so we just want to put the message out there that most immigrants and mixed status families can safely use public benefits. Public benefits used by family members won't count against the person who might be adjusting status and concerned about using public benefits. Only use of specific public benefits programs can even have a negative impact on a person's immigration status, and use of public benefits does not automatically make anyone a public charge. There's a lot of immigrants who can safely use public benefits, and a list is available here.
And you guys have all these resources on the Wisconsin Collaboration for Immigrant Public Benefits site.
All these resources are located, on that site. I'll put a link in the chat as soon as I get done reviewing these slides. But it is housed on Covering Wisconsin's site. You just go to the tab that says Immigration and Public Benefits. For immigrants who may be affected by the new rule, and we say new because changes were made throughout 2019 and then finalized in 2020. It's a very narrow group of people who are actually impacted, and it's a very narrow list of programs that are impacted. So that's all on the site. I wanted mostly to get this in the slide deck so people to raise situational awareness and get the information in front of people. So it's a limited number of benefits. And then go ahead, Adam, sorry. And then in relation to coronavirus assistance programs, those programs won't hurt your chances of getting a green card or U.S. citizenship. So unemployment insurance is not considered. Testing and treatment programs for COVID-19 are not part of this. Coronavirus stimulus checks are not part of this. Pandemic EBT food assistance is not part of this. Take and go meals at schools, not considered. Free and reduced cost internet and phone services, not considered. Mortgage relief policies and programs. So if somebody's, getting forbearance on their mortgage, that's not going to have an impact. Student loan relief programs, also not going to have an impact. Okay, so we got through the rest of the slides in rapid succession. I know we have a lot of questions, so we will attempt to go back through them now.
Yeah, we can go back to, I think, the one we paused on, which I don't have a good answer for, but I would still like to bring up because it's a great question. Do you know if unemployment eligibility changes if somebody has an offer of employment, for instance, because the Supreme Court has invalidated safer-at-home order and their workplace is open and calling them back to work? Again, I don't have a good answer, so I wouldn't I wouldn't say that I have the official answer to that. The way that unemployment is set up is that if you do have an offer of work, then you're supposed to take it. So in theory, that would affect your eligibility for unemployment. I would say the DWD site has a lot of modifications related to COVID-19, which, as people file their weekly certifications, we may end up in a little bit of gray area with a situation like that. I would just say, stay tuned. We will follow up, get our answer if we can from DHS or DWD on that, and provide that guidance for you, because I do think that's very important. That's what we're about to see probably a lot of. Because again, a lot of places were able to reopen, and at least in some capacity, as a result of that. So I would say stay tuned. It's definitely something people should be thinking about. If you do have an offer of employment, typically you're not able to draw down on unemployment. Copy the presentation. I assume that's coming. I bet even Jenny addressed it already. So yes, we will be able to get a copy of this out to folks. And yeah, the table, I'd say it's probably its best form so far. It is really useful to refer to. Oh, yeah, Jenny did. Okay, good. All right. Can we get a calculation formula on how income is counted for the different resources available, BadgerCare Food Share? I believe, so we have a lot of sheets on our website covering Wisconsin's website that include the different tables, and they're up to date based on the FPL for the current year that include how to calculate those. So having those as a resource is great. I don't know if Jenny can provide a link to those page. We have, again, just a lot of sheets, and several of them for each program are on eligibility and covered tables like that. The resource, another resource you'd want to keep kind of open in the back of your mind would be the FPL calculator, because that's, if you Google FPL calculator, there's two pretty good ones. One is through ABC for Health or My Coverage Plan Inc. I believe it's hosted on now. And there's another one, I think that comes up first if you search for it. And those are just really useful because, as you're punching in the income for these, you're looking at it and thinking about it a couple different ways now. So just to keep that in mind, have the tables for reference. The DHS site has the programs listed and pages for each program with the eligibility guidelines. And then an FPL calculator will help you cross-check what you're looking at versus the program eligibility guidelines. Food share benefits. With the cost of food escalating at an alarming rate, are they looking at increasing the maximum food share benefits? I don't know. I bet that they are or have. There is certainly federal guidance around that, and I'm sure certain also financial guidelines and implications around that, probably for the state budget as well. I don't know the mechanism by which they would have to increase food share benefits. Shannon, I don't know if you know. I'm guessing that there might be a significant, maybe even legislative component to that in addition to just a policy change. I'm not sure though.
Yeah, I mean, we know they went up to the maximum federally allowed level, so I would think the change would have to come on the federal level to increase the ceiling. And I don't have any intel on that.
Yeah, it's a good question though, and certainly something that if we find out about, we would be telling folks, and that the state would also be communicating to people in letters and through different updates.
Yeah. So we had a question on the energy assistance program and the deadline being tomorrow, May 15th. And that has been opened up. And so we believe the application is going to remain open.
Right. Looks like Jenny was able to provide the link. I believe that was the one you were referring to, Shannon, around the immigration and public benefits.
Yep, thanks, Jenny. She put in the link for immigration and public benefits. I think maybe she also put in a link about energy.
Yep, it looks like there's a link there or some information just grabbed from the web on benefits normally available October 1st through May 15th. Due to COVID-19, 2020 benefits are available all year. It was just done from a quick search. I'm sure we could find the best source for that. But yes, is the short answer to the question. That's been opened up.
Okay, and so now there are some people who applied for unemployment but still have not received anything, but are applying for BadgerCare, Food Share, or Marketplace. Should we assume that income is coming and use it in our eligibility income, or use what we actually have at the point of application?
That is a really good question. BadgerCare typically looks at what a person actually has. So, and remember that the application for BadgerCare can be backdated and also is retroactive to the first of the month. So in those cases, you're going to want to look at what they actually have, because if they don't have that income yet, they're not going to be able to pay a premium, for example, on the marketplace. So the short answer to that would be you'd be looking at actual income, going to BadgerCare first, and then if they get whether it's a lump sum or a lump sum that disqualifies them for BadgerCare, for example, then you'd want to shift to the marketplace. So BadgerCare, while their actual monthly income is zero, and then when their income increases, you're probably looking at shifting to the marketplace. Which the best tip / information I would say is, especially now, stay in touch with your consumers and make sure that they know how to get a hold of you. It's certainly something we always at Covering Wisconsin, our navigators tell folks, but it's something we really have been learning to emphasize is to make sure that they continue to see you as a resource and understand that they can call you with questions and situation changes. And in that one, if you can telegraph to them that their situation may change and to keep you posted if and when payments come through and things like that, you should then be able to help them navigate that situation.
Okay, and now we've got when a patient applies for BadgerCare through Covering Wisconsin, does the representative working with the patient ask if they have any outstanding hospital bills? And is the hospital contacted?
Oh, that's an easy one. It comes up, yes. We typically we encourage people to volunteer that information, so we're typically asking for it, I would say. It comes up almost always, whether we ask or not, because we're asking somebody about their situation. Oftentimes, it will be hospital bills and things like that that trigger them coming to us, and oftentimes it may even be hospital staff that referred them to us. So often that's on the forefront of somebody's mind. If not, we do ask, and we'll get to that, because we end up doing often either community care, charity care, or financial assistance applications, whichever the hospital system is calling it, to write those off if their income is low enough or to reduce them if it's not that low. But so yes, likewise, same thing comes up when we're looking at the BadgerCare application. We're looking at whether or not we should backdate and if the backdating would cover those bills.
And I imagine, Adam, you're not directly contacting the hospital unless the consumer is asking and giving permission for you to do so.
Right. We will contact hospitals usually with the consumer. So it happens, but it's because the consumer is there with us. And a lot of times it's to gather more information about a bill. They don't have everything in front of them, or they have a series of bills and they don't know what the total current amount is, things like that. We don't hesitate to contact the hospital in that situation.
So the next question we have, if a person qualifies for BadgerCare at this point with actual income, with new rules, even if the person's income increases, the person is allowed to stay in BadgerCare until the pandemic is over, right?
Yes. The short answer is yes. It depends, because it depends on that unemployment amount. If for whatever reason they, if they qualified, say single person, the maximum unemployment amount, 370, without the pandemic assistance, is enough to disqualify them for BadgerCare on its own. So if that's what's being held and that they haven't seen yet, they would then become ineligible for BadgerCare. However, this is the one that I always question, because people aren't being terminated from BadgerCare, so I would pay attention to that. So they may be able to stay on it, but also, yes, they could, if their income is higher, then want to transition to the marketplace. Looks like we've got.
Okay. So I think let's distill that down to some clear points, Adam, because I think.
Sure.
So if the person qualifies for BadgerCare and they get signed up and then something changes about their income, they will remain eligible for BadgerCare for the duration of the federal public health emergency.
Right. I think that's probably the biggest takeaway. It's just one that I'm very wary of when that's going to end and how that will be communicated to folks, because you just don't want to be in a situation where somebody is, getting BadgerCare, using BadgerCare, and ends up in a situation where they have bills. But yes, the language and the rules have changed, so somebody is not going to be terminated when that income comes through.
Okay, so we have a few recommendations coming through, things people want us to mention. So while waiting for unemployment benefits, apply for BadgerCare over the phone with the consortia to get BadgerCare ASAP and retain it through the health crisis, even when unemployment comes through.
Right. So that is the distillation you were looking for, I think, on what we were just talking about. Yes, when somebody comes to you and they haven't seen those unemployment benefits yet, and you can get them on BadgerCare, do it. And oftentimes, we know we get a faster response, and with IM capacity not being reduced at all right now, you should be able to call it and get them covered.
And I think there was something else. I'm trying to find it, so hang on a minute.
Okay. I see another recommendation is, could someone mention that it's important to remind consumers of their food share and BadgerCare Medicaid reporting requirements to avoid overpayments? Yes, that's what I've been getting at. Just generally speaking, when this ends, when the current situation pandemic ends, and rules go back to normal, reporting requirements will also go back to normal. So people will report income changes for food share, for BadgerCare, Medicaid, et cetera. And they don't want to end up in a situation where they are on a program that they're no longer eligible for. So yes, it's very important for consumers to remember to report changes and to stay current, whether they're going on the My Access app or working with an assister like us or like you all. Reporting changes is very important. We're in a little bit of a new territory here where there's temporary suspensions and delays on renewals and things like that. But otherwise, that is one of the main takeaways you would want to give somebody in an appointment.
Great. Okay. We are seeing no more questions. We'll give everybody, we do have 9 more minutes that we've committed to be on. So we'll give everybody just a beat. I know when I'm on webinars like this, I'll be thinking, and then they'll cut it off, and I'm always a little sad.
Sure. But also, just a reminder, we do have, is it on the next slide? But it's on the next slide. Yeah, the one next week, also at 1 o'clock. So next Thursday, we'll be looking at COBRA, because obviously that's a big consideration for people right now, and it may look a number of different ways depending on their employment situation, if they've been laid off, what that offer looks like, and the marketplace and considerations for the marketplace. And I believe the main speaker for that will be Julia Garvey from Partnership. And I know you have a guest speaker as well, Shannon. Can you please remind me her name?
We do have a guest speaker, and all I can think of is her first name right now. So just give me a second, and I will.
That's all I had too.
Her full name for you. But yes, Julia Garvey from Partnership Community Health Center will be one of the main speakers. We will also have someone from Covering Wisconsin, Jenny Appleby. And then give me just
doing
a
a great
second.
job moderating right now, by the way.
Doing an excellent job moderating, and we are ever so appreciative. And I'll get you the name of the other guest presenter in just a second.
Sounds good, because I know that discussion will include special enrollment periods and updates to the marketplace just generally, but those considerations that we really, as a sister, should stay on top of throughout the year. A couple other things came through.
Yeah, so the other guest speaker will be Ariana Anya from the Foundation Communities. That's actually a nonprofit out of Texas, and she will be speaking about screening for the Medicaid GAP SEP, special enrollment period, on the marketplace.
Cool, awesome. Looks like we did get a couple.
Did.
Express enrollment completed, obtained Medicaid, but then change unemployment received and denied for the full application. With change, patient was referred to apply for marketplace. Yeah, so I can kind of map that out a little bit. When you apply for express enrollment, you are presumed eligible for the month. So, you're getting all those services covered. You have BadgerCare until either you complete the full application and are eligible continuously, or that month or processing time ends, whichever is sooner. I don't see a way around that. So the way that this one's presented is they were eligible based on, hey, I'm in the hospital, my self-attestation, I don't have income right now, but then unemployment comes through and they're no longer financially eligible. I don't see a way around that. They would then want to go to the marketplace. Okay, I do see one way around that, but I don't know how well it would work. So in theory, if they were able to get on in a previous month through backdating, then they might be able to stay on BadgerCare, but I would want to check with the state to make sure that that was exactly how they wanted that to work. But otherwise, then they would be looking at the marketplace, yes. Women eligible for alien pregnancy Medicaid. So that's, I believe they're referring to the BadgerCare Plus prenatal program. remain on Medicaid past her birth, remain covered through the pandemic? Oh, that's a good question.
That is a good question, and we got a rapid response from a DHS rep who's watching. So
Oh, great.
we've got that EE is not granted the extension as regular BadgerCare Plus coverage.
That was going to be my guess. So that one is ending normally.
But that was a really good question.
Yeah, no, it's definitely. It's good to get questions because exactly. It's good to hear because then we know that people are seeing that or have the possibility of encountering that situation, and then information might be helpful for other people.
Yeah, thanks. These last two questions were especially poignant. Other questions?
Oh, and then I think Marciel's point actually here, it's EE, so that would be the express enrollment actually is not granted the extension as regular BadgerCare coverage. So again, yes, they'd be looking at the marketplace in that situation. Again, backdating may work. Maciel, you could jump in and correct me if I'm wrong on that, but say we're doing the example today, somebody had EE presumptive eligibility for May, but they were eligible for April through backdating. In theory, they could move forward with that through the not get kicked off that way. But I would want to double check that. That's what I would expect would happen. As for BadgerCare, I don't believe it's included due to a different pocket of money. Yeah, so the answer that we presumed or inferred from that about the prenatal, I think is correct, and it looks like Maciel thinks is correct. We could double check and want to be sure, but when the BadgerCare Plus prenatal program ends, we would then, I don't expect them to be continuously eligible moving forward.
And I did unmute Maciel. So Maciel from the Department of Health Services, if you had anything you wanted to add it to Adam's points, feel free.
Hi, everybody. Maciel Gomez, Southeast Wisconsin Medicaid Liaison. Just really quick, I just wanted to say that the extensions that were granted to the regular BadgerCare Plus population was not extended to the express enrollment population, which Adam and Shannon have already alluded to. The other thing is that because of the special circumstance for BadgerCare Plus for pregnant women, I did not hear that that was also included as far as the extension. That would remain as business as usual. However, I will be taking that back just in case to double check, and I'll circle back with our presenters to make sure they have the updated response.
Great, thank you. And then Maciel, would your read on the situation with the express enrollment be the same as mine? That if somebody, so express enrollment worked for that month, but if they were eligible for backdated coverage for a previous month, but like say April during the pandemic and during these policy changes, would then they be able to stay on it moving forward because that would be an actual BadgerCare application?
In theory, yes. I believe that if they were granted BadgerCare Plus for the months that they were eligible and not over income, that they may very well been approved for that extension to stay on. However, if it just so happens that they were not approved for that previous month, they would have to go ahead and apply at the marketplace. Right. So I didn't disagree with your assessment. We'll be taking that back.
Great, thank you. Yeah, no, it's worth looking at. So yeah, that's just a reminder when you're looking at whether it's express enrollment or not, the backdating piece obviously could be especially important. I know that generally speaking, the state doesn't want necessarily backdated applications for months where somebody doesn't have bills or didn't need them, but in this case, it could be especially important. Again, in theory, that's how it should work based on our interpretation of the rules, but if that changes or it turns out to be not the case, we will definitely let you know.
I had another question, and that's, can you clarify if a patient has Medicare and would be EBD eligible, can we now express enroll?
I believe based on if they fall into the category based on their FPL level, I think it's under 100. I believe that's how it's supposed to work. I don't know if the Express Enrollment Access for Partners Providers site has been updated to fully account for that, but I believe that interpretation is correct.
Yeah, and just to double check that everybody's understanding, that presumptive eligibility that was extended for the EBD population, elderly, blind, and disabled population, is within that 4 walls of the hospital system. It's not everybody who can do express enrollment. It's not the same. It's a different type of coverage that's available within that 4 wall of that hospital.
Gotcha.
Thanks. That's helpful.
Yeah, no, it's good to keep in mind there with express enrollment, there are different categories of assisters, partners, providers, again, 2 different categories that can do express enrollment for different populations. And hospitals have the most access that way.
So we've had another question just about next Thursday's meeting. We will be generating a link for registration for next Thursday's, or just a link for next Thursday's meeting shortly, and an email will go out later today or tomorrow with a copy of this presentation, the slides, an evaluation, and also a link for next week. So just save it on your calendar if you can, and we will we'll be back next week with more information about COBRA and the marketplace. If this presentation has raised questions, write them down and bring them to the end of next week's Q&A. We can certainly be all encompassing in the questions we address there. And we just want to say thank you so much for everybody's time and attention. We know it's valuable, and we are just so pleased that you joined us this afternoon.
Yep. Thank you, everybody. Really appreciate your time and questions. Great discussion.